floor. Go now, your life.
Good evening. Thank you for joining me today on a Thursday evening for this interactive session, live session, in which we're going to talk about a subject that is really very dear to my heart, which is the treatment of stubborn leg wounds. This is the first time I do this on Facebook or Instagram as an interactive session, and basically what prompted this is last week we did just a regular story on Instagram about a diabetic foot wound treatment, and we got a lot of positive feedback, and it was apparent to me that there was very little public awareness about the treatment of these wounds. So today, we're not going to repeat the same story. We're going to talk about a different type of a stubborn wound, which is caused by venous disease. So again, thank you for being here with me, and feel free to ask any questions that you want. I will answer them to the best of my knowledge, whether in Arabic or in English. And we'll just share information for half an hour. I hope that the information that I'll tell you will help a person that you love or it's just good general knowledge for you. So, to start with, I just want to show you the case. You know, stubborn leg wounds, they're not all caused by the same disease, but there are two main ones that are very prevalent, very common. One is the diabetic foot wound, which is القدم السكرية, and one is the wounds caused by venous disease أو عدم الكفاية الوجهية. Many people think varicose veins is just cosmetic. It's not true, actually. Advanced varicose veins can cause venous ulcers that can be very, very stubborn. We're going to show you some exciting cases, and we'll have a surprise for you also during the presentation about something that happened between yesterday and today. I just want to show you first, just as a brief. This is the wound that we showed last week. This is a diabetic foot wound. هذه قدم سكرية. So I saw this patient on July 24, and we did some very simple treatment that did not involve hospitalization, antibiotics, fancy creams, hyperbaric oxygen, or any gimmicks. Basically, basic treatment of the diabetic wound, which is not the subject of the discussion today. But this patient here had this wound for 3 years. And this is July 24, 2018. And I just want to show you what his wound looked like, what his leg looked like, August 2, 2018. So I haven't seen him since then because he doesn't need me anymore. His wound is totally healed. But today we're going to talk about venous wounds. What are venous stasis wounds? When we have varicose veins and venous insufficiency, there is venous hypertension. The blood in the veins is under high pressure, especially down at the ankles and the feet because of gravity. يعني في الدم بيترسب تحت. And when this happens, the leg swells. And also the skin becomes diseased and leathery. Can I show you with me here for 1 second? This is the beginning, the stage before developing a venous ulcer. See how the skin is brown and not soft? So now when the leg swells, it cracks up and it opens the wound. This is another picture. This is an earlier stage. See this brown discoloration? This skin is soft, is not soft. It's hard. And when the leg swells, instead of the skin expanding, it cracks. And you develop something like this, case 2. This is a wound. This is the foot. The toes are here. This patient, I saw him on February 19, 2017. He had this wound for 30 years. 30 years. I'm not exaggerating, I'm telling the truth. And we started his treatment, which is mainly basically cleaning the wound and preventing swelling. Because what happens is that every time this wound is trying to close, if the leg swells, the wound opens up again. So from February 19, 2017, this is February 22nd. It looks a little bit worse because I just cleaned it. I cleaned all the junk. And this is like 3 days later. This is a week later. You can see that the skin is starting to grow. And you can notice how the leg is less swollen because the mainstay of therapy was compression. And this is March 5, more coverage. And this is March 12. And this is March 15. So this is a real-time case of a patient who's had his wound for 30 years and was healed in 3 weeks with simple outpatient treatment. Basically, I treated his varicose vein, feeding this ulcer with sclerotherapy. We used a compression dressing, and basically that's it. So this is it. This is the same patient before and after. Case 3 is actually this patient, which is the surprise patient. This patient I happened to see by coincidence last night at around 8 p.m. Okay, and this is his wound. As you can see, it's 3 centimeters long, right there. Okay. Remember this wound. Now the patient I asked him to come today at 8 o'clock because yesterday I did some treatment on him, and we're gonna go inside and we asked his permission. We're gonna show you how his wound looks 24 hours after the treatment. He's had this wound for 6 months. So come with me. Hi, how are you? So, everything good? So tell us, how long have you had this wound? For how long did you have this wound on your leg?
Last 6 months.
6 months, okay. And of course you were treated with antibiotics and what else? Can you translate for us, perhaps?
क्या आपने कैसे ट्रीट करवाए थे आपने इससे पहला?
हाँ, इससे पहले मैं ईरान में भी गया था और दूसरे डॉक्टर.
He went to Iran and hospital.
No, we don't want to mention names. How many doctors he see for
कितने
this?
डॉक्टर देखे थे आप तक?
3.
3 doctors.
Okay. And yesterday, what we did is using this ultrasound. Where is the picture? Using this ultrasound, there was a picture here. I found the vein feeding this ulcer, and I treated it with sclerotherapy. And this is the wound, and I put a compression bandage. This is the wound 24 hours later. When did I see you first time, sir?
Yesterday.
I'm sorry?
Yesterday.
What time?
At
8 to 9 p.m.
And this is your second visit here, right?
Yeah, second.
In one day, right?
Yes, 24.
I'm telling the truth,
Yes.
correct? You can see how the wound is covered, and it is actually already 2.5 centimeters in length, and already 40% of it is covered with skin. So I'm gonna do his compression dressing now. Should I do it live, or should we go back?
I think let's go back.
Okay, let's do that. I'll come back in a few minutes.
Okay.
Okay, and we'll put the bandage again, okay?
Okay, thank you.
Yeah.
What's the reason why he had this wound?
Well, because he has what we call venous insufficiency. The blood, instead of going up to his veins, it goes down. And over a period of time, the skin becomes brittle. And when the leg swells, instead of the skin expanding, it cracks up with the wound. which is this wound here. Okay?
So if you heal it now, it will be forever?
Well, if we heal it now, it will be forever as long as we treat the cause of the problem, which is reflux and staphylococcus vein up in the groin. But we will do this after the wound is healed. And then he has to wear compression stockings, medical stockings. So basically what I'm really trying to preach and to let the public know is that these wounds, if you follow basic, if you first understand what's causing the wound and follow basic, simple ways to treat them. For example, the diabetic patient, his problem is pressure and no sensation. So you need to offload that area. The venous stasis patient, his problem is swelling and reflux in his veins. So you treat the varicose veins and you prevent the swelling by compression dressing, and you can heal these wounds. You can give this patient all the antibiotics you want, all the fancy creams you want. If you don't do compression therapy, it's not going to heal. I don't know if there are no questions. I'm going to actually show you the last case, and I just want to warn the audience that it's a bit graphic, but the result is dramatic. This is the case of a young woman who has a combination of sickle cell disease, which causes sludging of blood and venous reflux. Okay, I saw her in Lebanon. I think we'll see the date. I think it was May 2017. I think, and this is how her wound looked like. Yeah, May 2017. Okay, Haram, she was having so much pain. She's had this wound for 3 years. All sorts of treatments, fancy treatments, skin grafts, antibiotics, you name it. And just by simply cleaning it and using compression stockings and also treating her venous disease with EVLT, we became like this in 1 month. And this is in July. This is later in July. This is in August 9. This is August 19. And this is the final result, September 2017. So, and now I've seen her since then many times. She's at the point where she doesn't even wear compression stockings because we treated her saphenous vein that had the reflux with EVLT, and that's it. So,
I have a question here.
Yeah.
Someone is asking, how do you prevent it? The wound.
The wound. Well, you prevent the wound by, in the cases of diabetic patients, by making an insole for the foot, for the shoe, that allows the adequate distribution of pressure. Okay? And also, the other thing that's important with diabetic patients is early detection. The diabetic patient does not feel that he has a wound. By the time there is a wound, the family knows about the wound. It's when this wound gets infected and starts smelling. The patient doesn't feel it, doesn't have pain. So, other than using a special shoe for the diabetic patient to distribute the weight of the foot, it's something very simple. You have the wife or the daughter just check the foot once a day. Make sure there isn't anything brewing, anything starting. And then she should bring them to the doctor. Not wait until the wound has festered and got infected. For the venous stasis wounds, it is to treat the varicose veins, the venous insufficiency, either with sclerotherapy or sometimes with a procedure called EVLT, and also in elderly patients who cannot tolerate the procedure or cannot afford the procedure, simply to use proper graduated compression medical stockings to prevent swelling, which is the reason the wound starts. And once the wound starts, immediately aggressively treated with inelastic compression. I hope I answered the question.
في سؤال بالعربي.
إيه.
شو الأسباب يا دكتور؟ شو أسباب الوونز؟
أظن اتطرقنا عليها شوي بالإنجليزي قبل ولا بالعربي. اللي عنده السكري، القدم السكرية، السبب هو شيء اسمه نيوروباثي أو تلف العصب. وكمان في حالات سببها نقص الأكسجين عشان في انسداد بالشرايين. بس معظم الأحيان بأيام اللي عنده القدم السكرية هو تلف الأعصاب. يعني المريض بدل ما يمشي like this هيك بيمشي بحط ضغط على محل وحدي، على منطقة وحدة من الإجر، وهالعظمة بتصير بتحفر بالجلد وهو ما عنده إحساس. هذا عند السكري. بالجروح الوريدية بسبب عدم الكفاية الوريدية هو زي ما قلنا ترسب الدم وزيادة الضغط بالأوردة والتوزن بالرجل أو الورك.
في سؤال ثاني بالعربي.
نعم.
كم وقت عشان يتعالج؟ من وقت.
كل كيس بيعتمد لكيس. في عندنا مريض لفاجكتومية مثلا له الجرح عنده 30 سنة شفي بين 19 فبراير 14 مارس. المريضة الآخر كيس فاجكتومية إياها اللي عندها السيكل سيل ديزيز مع الفينوس ديزيز أخذت 4 أشهر من شهر 5 لآخر شهر 8 3 أشهر. هذا المريض اللي هلا شفناه ذا لايف بيشنت أنا بتصور بظرف أسبوع بيشفى، لأنه هلا أوريدي من امبارح لليوم في 60 ل 70% تحسن. بس القصة قصة أسابيع أو حتى أقل. Anything else before we have our dinner?
What's the next topic?
The next topic, well, I don't know. We have sclerotherapy.
Yeah, I want sclerotherapy.
I like wounds. I want wounds.
Enough of wounds.
Sclerotherapy. Yeah, we can do that. We can do next week. علاج الدوالي sclerotherapy. شو الفرق بين liquid sclerotherapy foam sclerotherapy أو بالعربي العلاج التصلبي والعلاج التصلبي الزبدي؟ في كتير مغالطات انه هدول الاوردة السطحية بتعالجوا بالليزر. بنجاوب المغالطات. كمان فينا نحكي عن المغالطات الاخرى عن الدوالي، انه لبس الكعب العالي بسببهم، او اذا وحده بدها تجيب اولاد ما تعالج الدوالي بدها تخلص الاولاد. يعني في غلطات وحكي صالونات سو تو سبيك عن معالجة الدوالي. وإذا بتحبوا فينا نحكي عن الموضوع الأسبوع الماضي. بنشوف الجماهير شو بجاوبونا. هن شو يطلبوا؟ أنا شو بده الموضوع عن له علاقة بالأوعية الدموية فينا نحكي عنه. فبنشوف شو الجماهير بتطلب. الجمهور بيطلب مش الجماهير. بلش راسي يكبر. ومننقل الموضوع ان شاء الله كل خميس بنجرب نعمل هيك انتراكتيف سيشن. وفينا نحكي عن مواضيع ثانيه كمان، وطبعا بقيه الحكمه بالشمع كلينيك فينا نحكي عن مواضيع متعدده. همنا الحقيقه عن جد هو توعيه الراي العام، خاصه هيدي قصه بدي ارجع لقصه القدم السكريه والفينس وونز. يعني ما في لكم قديش المريض بقاسي وقديش في لسوء الحظ ما في توعية كافية للطرق السليمة ونفس الوقت بسيطة إنه علاج الأشياء. دكتور ما تأخذوني نعم.
بس في سؤال أخير دكتور بس
برا
برا الموضوع، هل اللي عنده عروق بارزة تحت العين بس بشكل بسيط تكون الأسعار ثابتة؟ اللي عنده عروق تحت العين هل السعر ثابت لو بسيط؟
السعر؟ ما بتلبك لما احكي عن هالمواضيع. اذا حاب المريض او المريضه يبعث لنا صور وفينا الفاسكولار كوردينيتور فيها جواب على الموضوع. بدنا موضوع طبي مش موضوع عن الفلوس. لانه في مريض جوا ناطر عمل له جرحه.
Thank you so much, Doctor.
شكراً.
Thanks for the time.
Thank you, staff, and thank you, Mahmoud, for being here. And I wish everybody a weekend.
Thanks to you too. Get some rest.
Yes.